Do you take your asthma medications as prescribed? So many patients suffer unnecessarily because they do not take their inhalers as prescribed by their healthcare providers.
A common mistake is that patients stop taking their asthma control medications once they start feeling better. This puts patients at risk of having a severe asthma attack.
For more information, please stay tuned.
When a healthy person takes a breath, air travels from the nose and mouth through the airways and into the tiny spaces of the lungs. The lungs allow oxygen to enter the body when breathing in and waste products to exit the body when breathing out. When a person has asthma, this entire process becomes much more difficult.
Asthma is long-term, and it causes narrowing and swelling of the airways. Swelling is also called inflammation. Airways are the tubes that are responsible for carrying the air that is necessary for life into and out of your lungs. Inflammation caused by asthma makes the airways very swollen and overly sensitive to certain triggers. Triggers can be different for different people. They are things like dust, animal fur, cockroach droppings, mold, pollen, cigarette smoke, air pollution, chemicals, infections such as colds, physical activities like exercise, stress, or strong emotions such as laughter or frustration. In response to these triggers, the airways react by making the muscles around them tighten, which makes the airways become narrow and reduces the amount of air that can travel through them. In addition to the tightening and swelling, the cells of the lungs begin making thick, sticky mucus that further narrows the airways. This chain reaction results in symptoms of asthma such as trouble breathing, chest tightness, wheezing, and coughing.
Asthma is a condition that cannot be cured, but asthma can be managed. 2 forms of management are currently available. Quick relief medicines or rescue inhalers, such as albuterol, are used before exercise or to treat asthma symptoms by temporarily relaxing the muscles around the airways. Controller medicines, or inhaled corticosteroids, are used for prevention, but no immediate results are seen. Put simply, the 2 forms of management are prevention and fast action. Let's take a closer look into the different asthma management options.
A rescue inhaler or quick relief inhaler is often used during an asthma attack, sudden wheezing, shortness of breath, or increased activity such as playing basketball. Your rescue inhaler should be with you at home, school, and sports activities. It should be available for emergencies at all times. Albuterol is a common rescue inhaler prescribed by healthcare providers. The rescue inhaler is a great therapy, but it does not have any long-term effects on the airways. It lasts for a short time and does not reduce inflammation or swelling. Though it will provide immediate relief, it will not improve your asthma over time or prevent future asthma attacks.
Inhaled corticosteroids have many different names and different packaging. Qvar, Flovent HFA, Advair, Aerospan, and Dulera are just a few.
These medications are used to control asthma and are normally taken every day. Just as the swelling did not occur quickly, the corticosteroid inhaler does not provide immediate relief. If used as prescribed, inhaled corticosteroids have a long-term effect on opening the airways by reducing inflammation and allowing more efficient breathing over time.
There are many myths about inhaled corticosteroids. They are not to be confused with the type of steroids that some athletes use to make their muscles large. Corticosteroids taken through an inhaler do not cause weight gain like other steroid medications, and they are not addictive drugs. It is recommended that the medication is taken with a spacer to ensure that the medication is inhaled properly. Inhaled corticosteroids should be part of your daily routine, like washing your face and brushing your teeth. Also, be sure to brush your tongue and rinse out your mouth after using the inhaler.
A note to patients who are taking Advair. If you still need to use your rescue inhaler often, please contact your healthcare provider. This may mean that they need to increase the amount of corticosteroid you're currently taking.
And as always, if you have any concerns about the use of inhaled corticosteroids, please don't hesitate to ask your healthcare provider.
Asthma is a real problem. It's common and it's deadly. In 2009, the Centers for Disease Control reported almost 500,000 hospitalizations, 8.9 million doctor visits, and 1.9 million emergency department visits due to asthma. In 2010, it was found that 1 in 12 adults and 1 in 11 children suffer from asthma. Unfortunately, about 9 people die each day from asthma. Some shocking information that you may not have known about asthma is more women die from asthma than men. And Black Americans are 2 to 3 times more likely to die from asthma than any other racial or ethnic group.
Asthma is a manageable condition, yet every day people die as a result of the disease. Each and every life is important, so we want to fight for prevention and urge children and adults to take their medications as prescribed.
My daughter and my little sister have asthma, and when I was a little girl, one of my very close friends died at the age of 12 from an asthma attack.
I can understand. Actually, a family friend of mine died at the age of 6 due to an asthma attack. Both my niece and my nephew have asthma, and my twin sister was hospitalized more times than I can remember due to asthma. And to this day, we can still feel the effects of the trauma that we experienced being in a hospital at such a young age.
Yeah. I really hope that the patient education and the asthma video really helps to prevent tragedies from happening like this less often.
Yeah, asthma is definitely a manageable disease, and we shouldn't see deaths anymore.
I agree.